Hi, everybody. Thanks for joining us on this perfect Puget Sound day here in Kitsap. It's the Kitsap Digital Hour, and it's a two-parter or a three-parter. This is organized around saving the holiday season. Our small business community has been through a lot. We believe it's very important that we focus on our small businesses and spend dollars in Kitsap to the extent that we can. It's been a really tough 18 months for them. And we're headed into winter. Winter means a couple things. It means we're not spending as much time outdoors. It means that we could be headed for more difficulty, and we want to minimize that on our local businesses to the extent that we can possible. And every dollar you spend in Kitsap, whether that's with a service provider or whether that's with a retailer or a restaurant, it really goes far in our local economy. It creates economic benefit. So at Kitsap EDA, that's what we're focused on through the end of the year. Today, we're hearing from experts in health, as well as experts in retail and experts in search engine optimization and search engine marketing. So the first part of the program, we're going to hear from Dr. Gib Morrow, and I think we are also joined by Lindsey Camerena, who is a registered nurse. And so we're going to talk a little bit about what the vaccinations have been like here in Kitsap, what we're seeing in the community and what some of the trends are, and also how we can be safe during this holiday season as we shop. So we're going to start there, but we've got a really full hour. We're going to also hear from our expert in search engine marketing and our expert all about Shop, Eat, Spend, Kitsap. That's Katie Crain on the search engine marketing and search engine optimization side, Aljolynn Sperber on Shop, Eat, Spend, Kitsap. And that is what we're up to. So you can go to shopeatspendkitsap.com and get all the information you need there. Heading into November, it's Global Entrepreneurship Month. There's going to be quite a few opportunities. If you Google Startup Washington, you can see the schedule that is becoming available to folks. And Kitsap EDA is going to host a couple discussions, one of them being about HR and workforce with Monica Blackwell, and one of our partners, Sanaa Bagirsh with Tamakan. Sanaa is an entrepreneurial ecosystem builder. By the way, we do have the great Jamie Forsyth on the line from the Small Business Development Center. And we will check in with her at the end of this hour to see what's going on in the world of governmental support and federal support for small businesses. So without further ado, let's turn things over to Gib and Lindsey. And I just want to say also a big thanks to Gib and Lindsey. You know, they're really doing public service work right now, and they are at minimum taking a lot of heat for it, and that might be putting it lightly. And it's important to remember that the work that Gib and Lindsey do really have all of us they have us all in their best interest, and they're trying to keep our community safe and healthy. And so Gib and Lindsey, I'd like to thank you for that, and turn things over to you, and thank you for the work that you're doing.
Well, thanks, Joe. And yeah, thanks for having us. We all need to acknowledge just right off the bat that public health requires a healthy economy, and really we're just trying to balance all the competing interests and factors. So with that, if I can go ahead and try to share my screen here, it looks like we're good to go. Let's see, I need to swap those over. So are the visuals okay? Give me a thumbs up, Lindsey, maybe, if that looks like it's coming through the way we would want it to.
And I see it, and it looks great.
All right, awesome. So just the agenda, we'll run through where we are, what's going on with respect to hospitalization, death, outbreaks, testing, businesses in particular, and then a little bit about vaccinations. Hopefully, our recent health board meetings have stimulated a little bit more interest in vaccinations. That's really our ultimate goal. So Case rates and disease activity, we crossed up into the CDC high transmission zone on August 1st. And on that day, I just discovered we hit exactly 100 cases per 100,000 residents over a 7-day period. We've been there ever since. We got up to a peak of 322 on September 13th and are seeing a little bit of just a gradual decrease, which is really encouraging to see. We were literally running on fumes here in the health district, trying to keep up with what was going on. And it was not a pretty sight. With respect to how Kitsap has done relative to the rest of the state throughout the pandemic, the dark green line on the graph shows our county with the shaded area representing the state as a whole. And we outperformed the state, generally speaking, until very, very recently. We did cross briefly into an area just above, but we're back in a kind of the happy zone at this point. And you can see on the state map there, we are in the orange. We're an orange color, nothing like Okanagan, Omak, Ferry, some of those other places off to the east. The Washington state average is 210. That's the 7-day case rate per 100,000. Ferry, Grant, Mason are all quite a bit ahead of us. Kitsap's in the highest performing quartile, I would say, 31st out of 39 counties, but nowhere near where King, Jefferson, and San Juan, our most highly vaccinated counties in the state, are. San Juan is really outperforming us all, perhaps with the exception of Bainbridge. I've tracked those two places competitively, and Bainbridge is doing a good job. So with respect to what's going on in the kid population, we were quite concerned about that when school started. And that dark line shows the 5 to 18 year old case rate referable to the general population as a whole. And there was some concerning divergence, which made it look as if kids might be driving cases in the schools. That was very concerning to all of us. At this point, the highest disease activity is in the 19 to 34-year-old cohort. I'm going to speak to that a little bit more momentarily. The 12 to 18-year-olds are creeping up a little bit, as you can see, and are sort of kind of just right at the same level as that group that is probably their parents. We continue to see higher disease activity in Hispanic Latinx as opposed to white. The third group on that lower race ethnicity group is a number of different racial ethnic groups all lumped together, and it's not that helpful. But what's going on across the country, this is the CDC map, high transmission everywhere, but essentially California and a couple places in the Northeast. The one there in the Southeast, I think, is just not fully reporting. But outbreaks right now, I think it was 15 in schools yesterday. It's bouncing around between 10 and 15 with respect to active outbreaks. Government, lots and lots. Long-term care facility outbreaks. Some of these have been really crushing in their size, and they have contributed considerably to significant bottlenecks in the continuum of care in our healthcare system, leading to delayed discharges, backups into the hospital, boarding patients in the emergency room, and delayed EMS drop-off times, which has really degraded the emergency services in our county. That is a big, big public health issue. Hospitalizations, look what's happened in Kitsap. It was just tragic and shocking. September had the most throughout the entire pandemic, with over 200 in the month of September alone. St. Michael's was just flirting with those blurred borders of crisis standards of care. I talked about the bottlenecks, the boarding of patients, the cancellations of elective surgical procedures. That was a topic at some emergency health board meetings, which I would encourage you to watch, particularly the one on September 7th, when Lindsey Camerena spoke very, very eloquently about what was going on. Follow-up meetings on the 28th, and more recently, I think it was October 5th. So we've had the most hospitalizations in Kitsap throughout the Delta surge, despite the widespread availability of vaccinations. It's also done the same thing across the region and the state with respect to hospitalizations. Please remember that when you get hospitalized these days, you are truly, truly ill. So deaths, 52 Kitsap deaths in the month of September, 25% of all pandemic to dates, more deaths in September alone than in all of calendar year 2020. Those deaths are preventable. So Delta and vaccination, how do they impact hospitalization and death? So you can see on the hospitalization, those are sort of bell-shaped curves for age distribution. For hospitalizations in green, you can see a gradual shift toward younger folks. The highest decile, I guess you would call it, is the 60 to 69-year-old group since Delta started to surge. Fewer folks in their 70s and 80s. With deaths, you see a similar pattern. Again, all preventable. So it's not all just about the hospitalization and death. There's a lot of long-term consequences we're going to be looking at. 50% of the folks that are hospitalized 1 year later continue to experience long-haul symptoms, fatigue, shortness of breath, weakness, brain fog, you name it. Over a third of veterans in a VA study showed long-term significant kidney dysfunction. This is a vascular disease. It affects the blood vessels. It gets into the heart muscle, gets into the kidneys, gets into all the solid organs. It leads to long-term scarring of the lungs, significant neurologic complications. If nothing else, we should all worry about that. Around the country, some states are letting private insurers no longer waive cost sharing for COVID treatment. Here in Washington State and federally, all vaccinations are free. All COVID treatments are without cost to individuals. So please remember that the emergency use authorizations, as well as the full-on approvals for vaccinations, monoclonal antibodies, some of the newer treatments are covered. So we'll talk a little bit about testing. I'll probably skip that just to get down to the meat of things. But we do want, and we ask all of you in the business community that when you are contacted through our case and contact organizational outreach teams, please help them out. I mean, you're helping yourself out. You want to contain the spread and keep disease out of your businesses. We want to keep your businesses open. The best way to do that is vaccinations, but we still got a long way to go. We are seeing gradual upticks, but again, that 19 to 34-year-old age group is still lagging, and we have a long way to go with respect to get people vaccinated. So, again, Bainbridge, high performer, North Kitsap doing pretty well. You can see a little bit of a decreased rate of percent initiated vaccination in central and in Bremerton areas. A lot of, we do know there have been about 17,000 vaccinations given at this point through Naval and Department of Defense efforts that may not be showing up just because we know their numbers, but we don't know where the folks lived. Those are areas where our naval bases are, and they may be doing a little bit better than that. I hope they are. So we are starting to see a little bit of an uptick in vaccinations. Just remember, Vax Day back was April 15th. The governor said everybody's good to go, and people stopped coming in. Why? The third dose of Pfizer boosters the third dose for the Pfizer series was authorized on August 12th for those with immunocompromising conditions. And just a couple weeks ago, the Pfizer boosters were approved for everybody 18 and older who has previously received Pfizer and is either over 65, has a medical condition that puts them at higher risk, or works in a high-risk occupational setting. Basically, you're good to go if you want to get it. We're not asking a lot of questions. Today and tomorrow, the FDA Advisory Committee is meeting to discuss Johnson & Johnson and Moderna. I wouldn't be too surprised if they come up with a recommendation to allow some cross use of different boosters. For example, You may want to follow J&J with a mRNA vaccine and/or vice versa. We will see. That's to be determined still. That same FDA advisory committee is meeting on October 26th to discuss mRNA vaccines, specifically Pfizer, for the 5 to 11-year-old crowd. So we really want to get those kids vaccinated as soon as possible. The sooner the better. It is not going to be stick or treat for Halloween, unfortunately, because once the FDA approves this, the CDC's Advisory Committee on Immunization Practices still needs to meet. They're doing that on November 2nd. But if they give the thumbs up and the Western State Safety Group does, we can get kids vaccinated by the year-end holidays, which would be just fantastic. So I want to talk a little bit about kids. You'll see, and I would encourage you to read a editorial I wrote and just submitted this morning to the Kitsap Sun, which speaks to the fact that 140,000 U.S. children have been orphaned or have lost a primary caregiver grandparent throughout this pandemic. It's tragic. Again, as we've seen repeatedly throughout this pandemic, the impacts are disproportionate, and American Indian, Alaska Native families have been hit the hardest, followed by Black and Hispanic, and then Asian and whites in that order, with a very significant differential. There are going to be some really long-term and very unfortunate future consequences of this. The vaccines work. This is out of King County from about a month ago. The vaccinations prevent 7 cases for every case that occurs in an unvaccinated patient. If you are fully vaccinated, you are 42, people who are unvaccinated are 40 times more likely to be hospitalized for COVID than people who are vaccinated. And it's true as well for deaths. Our data in Kitsap confirms that. So in the past 30 days, for people under age 60, those who were unvaccinated were 32 times more likely to be hospitalized for COVID than those who were fully vaccinated. The differential drops off for people over age 60. They tend to be more vulnerable. They tend to lose their immunity a little bit more. And they're also the folks that are in nursing homes who are getting, who are just more vulnerable and frail, and who are getting clobbered again, unfortunately. But there is a gradient of protection from the vaccines. First and foremost, they protect you against death. They do this so well in Kitsap that I can't even tell you how convincing our data is, because that would be potentially a release of personally identifiable health information and release some privacy issues for people who have died. But they also prevent severe disease. They prevent hospitalization. To a slightly lesser extent, they prevent mild to moderate disease, but they also prevent asymptomatic infection, and they reduce transmission. So before we get into this mandate issue, which, my favorite topic, Joe, can't wait to hear from your group. I do want to talk just for a moment and acknowledge a lot of the misinformation, and what's even more concerning, the disinformation that's circulating out there. I just have been barraged by it. Disinformation is really intentionally misconstrued information that really is geared to confuse the public and undermine national security and the truth. And it's really unfortunate to see it circulating. The vaccines, we are tracking very, very, very closely. We know what they do, and we know what they don't do. With the mRNA vaccines, there is a risk of anaphylaxis. This can be fatal. The risk is about 5 per million. That's why we do the 15 to 30 minute observation period. Nobody's died in Kitsap of anaphylaxis. We know with Johnson & Johnson, it causes very, very, very rarely a drop in platelets and a clotting disorder. That's why those vaccines were paused back in April. There were 3 deaths related to that when they were paused. There was another one that's happened more recently in King County. That's 4 out of about 18 million. It's a real thing. It's more common in younger women, and again, that's a group that might want to consider getting an mRNA vaccine instead of a Johnson & Johnson. There is a risk of myocarditis. It's about 1 in 40,000. We've seen it in Kitsap. I've personally reviewed the records. As in Kitsap, so goes the rest of the country. The vast majority of those, even the ones that were hospitalized, were self-limited. They were temporary. They resolved within a day or two, and thus far do not really appear to be leading to any long-term significant complications. Those are occurring in typically young males, but the bottom line is that the risk of those complications occurring as a complication of COVID itself is 4 to 10 times higher. The New England Journal of Medicine and its authors have put out an endorsement for getting vaccinated and just acknowledge that these complications of the vaccines need to be taken in the context of your alternative. You're either going to get the vaccine or you're going to get COVID. Pick your poison. My recommendation would be to pick the vaccine. So with that, I do want to talk just briefly about mandates. They are absolutely never plan A in public health. I want to say that I never recommended imposing on the business community a vaccination requirement system, but they are being implemented not only as a requirement at Kitsap Public Health District, and I'm proud of it, and I'm proud that all of our employees are getting vaccinated and or going through the accommodation process, but airlines, healthcare, football games, banks, communications, government, transportation, you name it. And what I would like to see, and my ask of the business community, is you should, in my opinion, implement vaccination requirements voluntarily for your staff and your customers. That's how we're going to get your business places safe. It's how you're going to keep them open. It's how your customers are going to know that you're a safe place to come and eat and shop. As soon as you do that, I'll come patronize your business. I hope you do it. With that, I want to turn it over to Lindsey Camerena just for a couple words, and I will stop my screen share and happy to take any questions.
Thanks, and we'll go to Lindsey, and then after Lindsey, we'll come back to me, and we'll save questions for the end, Gib, if you have time to hang out. We appreciate your time. Lindsey, thanks for joining us.
Yeah, thank you for inviting me. So, ma'am, my name is Lindsey Camerena, and I'm a Kitsap public health nurse. And Dr. Morrow had invited me to come on and just share a few words from my, I'll say, the multiple hats that I wear. I grew up in Kitsap County, and I currently make it my home with my 2 children and my husband. So I'm wearing the hats currently of a public health nurse, a community member, a parent of 2 school-age children. I also part-time in the COVID ICU. Also, I've recently lost a couple family members to COVID, including a 45-year-old with no comorbidities. And I have another family member who has long COVID and has been out of the hospital for a month and is still on oxygen. So keeping in mind the seriousness of COVID, and also my role as a community educator, I helped with the vaccine team at KPHD to set up and run the vaccine clinics. Another hat that I wear is community education. So when I was approached about coming to speak here today, I just wrote a couple things. I think that maybe my perspective is a bit intertwined as a health conscious consumer who is also an RN, and also someone that I get asked a lot of questions from community members in my role and out of it about my thoughts on COVID. So I just wrote a couple things I'm going to read. Thank you for listening. So in March of 2020, my family stayed home to stay safe to the best of our ability as the world around us shut down. As commerce gradually and then rapidly opened back up, our pandemic-acquired behaviors have not entirely followed suit. While my family and I and many of my friends mask up and carry on with our lives to the best of our ability, with our kids back in school, working full-time, and participating in a variety of extracurricular activities, it would be inaccurate to say that we feel comfortable in all businesses and in all circumstances. Some places of business leave us saying, we felt safe there, let's go back, while others cause us to glance at each other, quickly purchase what we need, and make a fast retreat out the door. We retrospectively comment to each other that we didn't feel comfortable in the environment and we don't plan to return. What, you ask, would make a difference in my peace of mind in knowing where I would feel safe and welcome to shop and eat and experience? Am I destined for a future of guesswork, discomfort, and uncertainty? I don't think it has to be this way. It would be amazing to know what I am walking into before I walk through the doors, to know where I'm walking into is welcoming and clean and mindful of their customer safety and comfort levels. Knowing where a comfortable and safe environment exists to shop would make a world of difference in my mind. Might there be a space that I could go, an online list, or a business badge or other indicator that would let me know the safety and the offerings of options such as curbside pickup, appointments or reservation ability, outdoor dining, air circulation, masking, social distancing opportunities, cleanliness standards, and vaccination percentage levels for employees and possibly customers. I truly enjoy going out to local restaurants for dinner with my family, meeting a friend for coffee, and shopping in and supporting locally owned businesses whenever possible. Knowing a handful of COVID-safe options at businesses up front would make a world of difference for me, my family, and countless others in our network of friends and family. Thank you all for your time, and I hope to see you all out collectively supporting our local community businesses. Thank you, everybody.
Thank you so much, Lindsey. And I'm sorry for your loss, and I'm sorry for everybody who has lost somebody during this crisis. I'm going to admit that, and before we turn things over to Katie Crain with Urban Sherpa Marketing, I'm going to admit that I've lost somebody. And I'm going to admit that I haven't really eaten in a restaurant in 18 months. I've eaten outside, and I get a lot of takeout, and I support our local community. But I think my wife and I are going to go to our first restaurant tomorrow. And we're excited because we haven't been in a restaurant in 18 months. Anyway, thank you so much for sharing that, Lindsey. Gib, thanks for talking to us as well about the facts and figures. You know, if you're 40 times less likely to be hospitalized if you have a vaccine, and even more orders of magnitude to die, the numbers are really clear, and the risk assessment needs to be to the best of your ability, understanding that I think about 10% of the population at this point has had COVID. We've had 720,000 deaths nationally. And the strategy that our nation is pursuing is vaccination. And not a lot of other strategies are out there. Yeah, social distancing, masking. But the way we think we're beating this is vaccination. All right, enough. And it's nice to know that Kitsap's beating the state average. Go Kitsap. Bainbridge, you're leading the way. Thank you, Bainbridge. All right, let's turn things over to Katie Crain for search engine optimization, search engine marketing, Google AdWords, how you can be relevant as a digital business and as a small business, small retailer or small business, utilizing those tools. And we'll also hear from Aljolynn Sperber on some social media aspects and, of course, Shop, Eat, Spend, Kitsap. So, Katie, thank you. Take it away.
Okay, now I'm going to share my screen here, and this is a huge switch in mood and tone. So but can we see my screen just fine? Is everyone looking at my screen? All good? I'm going to assume all good unless someone pipes up.
We've got you. It's
perfect. Okay, so I have a lot to talk about. I could go on for, I actually in a panic emailed people going, I don't know how to cut this shorter. So I'm going to really keep this high level, and hopefully we can answer some questions in the end. But I wanted to say one thing: I've added some extra resources at the back of this presentation that when you get the slides, you can find. So if you're missing something, I can either answer it at the end of the presentation, end of the webinar, or you can just look at stuff. So I'm going to get started. So first of all, I want to make sure I'm here to talk about SEO, SEM, and Google My Business. But what one of the first things I want to make sure is that everybody is clear about what the difference is and what SEO and SEM really are, because I hear people conflating the two, mixing them up, acting like they're the same thing. And a lot of smaller businesses, they hear about things and they don't necessarily know what they are. So basically, they're actually quite different, but what they're both doing is they're ways in which you help people find your business if they are searching for certain keywords online. So that's what they are, it's how they're similar. Let's start quickly with SEO. So SEO, as many of you know, stands for search engine optimization. And this is everything you do to your own website and other properties that you own, like Google My Business, which we're going to talk about in a second. These are the activities you do that convince Google that your website is a good return a search result if somebody is searching for a keyword related to your business. So if you're a shoe store and somebody searches for shoe stores, you want to convince Google that your website is a good result, or your Google My Business post is a good result for that. So this is what we call organic search results. So this is Google is, putting this is not an ad, it's just an organic search result. The reason we love SEO so much and why marketers talk about SEO so much is that people tend to trust the organic search results more than they trust an ad. It's just human nature. So let's talk really quickly about some pros and cons here. First and foremost, search engine optimization, SEO, is free. I have that in quotes because it does take someone spending time on it, which is not free. All of us business owners know that that is not free. And if you don't want to do it yourself, you need to pay someone. So it's only free in the sense that you're not paying Google for the right to do this. And also it means that if you get a good page authority and your site is showing up regularly at the top of the results, you're going to have a lot of free traffic, free advertising that is excellent. So this is the gold standard. This is why we're all searching for it. Now, it is the reason we talk about it a lot is even though it is a lot harder for national brands, I'll talk about that in a second, it is really good for local brands where there's less competition. And this is the reason for that is that with an organic search result like this, you are competing with everybody else online who has optimized their site, who is doing SEO for the same keywords. On a national scale, say you're a shoe store, you're competing against Zappos, DSW, Famous Footwear, and you can imagine how much page authority and domain authority they have built up because they have all these people visiting their site, buying things, staying on their site for long periods of time. They've been there a while. They have SEO marketers working for them. So you have to compete against all of that. On a local level, you have an advantage because if somebody is searching for a shoe store in Kitsap County, and Google knows they're in Kitsap County, they're going to put Kitsap County shoe stores up ahead of some of the big national things because they're assuming you want something local. So we really want, as local businesses, paying attention to SEO is really important. And for some local businesses, this means you don't have to do other stuff, but really we don't recommend that necessarily unless you've already achieved it because it sometimes doesn't work. This is one of the tragic things about SEO is you can do everything right, spend years on it, and you might still not achieve first or second page placement simply because there's too much competition. We recommend doing this like maintaining your house, but don't expect this to be the thing that's bringing customers in the door. Now, talking about things that bring customers in the door, let's talk about SEM. This stands for search engine marketing. You may have heard pay-per-click or Google Ads. So this is, instead of working on your own website, this is going to the Google Ads platform and paying them so that when people search for keywords like shoe store, an ad shows up that says, hey, we're a shoe store. The really great thing about this is that you can control it better. You can set it live and tomorrow you could have people hitting your site or immediately you have people hitting your site. Pros, cons here, like I said, it works. It is one of the most efficient marketing things you can do in the sense that say you put an ad in the paper or you put an ad on a billboard and you're a children's shoe store, maybe 1 in 50 people is going to need children's shoes right then. And so it's a really inefficient audience. But if somebody's searching for for children's shoes on Google, they need children's shoes right now. They are a really efficient audience. And so your money, when they click on your ad and you only pay when they click, is going directly to somebody who is likely to buy. Downside, it's hard to do yourself. I've known some really good self-taught small business people who do their own search marketing, and they're great at it. But a lot of us, it's a steep learning curve. And so most people really do feel more comfortable hiring an agency or a search agency, and that takes money. And it also takes money to pay Google, because this is, of course, paid advertising. So you need to be able to pay Google enough that you're getting a good return on your ad spend. We usually recommend starting at about $500 a month for most small businesses, if they can do that. Otherwise, it's going to be a little more diluted. They're not going to see the results as much. And that depends entirely on how much competition there are for search terms. We recommend that if you can, most small businesses should do this if they are not already showing up in the organic placement. So if they're not on the first and second page, if somebody is searching for, like, their shoe store, searching for shoe stores near me, you're not showing up, then this is a really good thing to do. Let's switch quickly back to SEO. And I know I'm going really fast, but time is limited. Here's 4 things you can do right now for SEO if you're not already doing them. First and foremost, you need to know what your keywords are. If you're a dentist, your keywords are likely going to be something like dentist, or dentist near me, or dentist in Paulsbo. Remember your cities, because we're trying to keep this tied to local, or teeth cleaning. So you need to know what your keywords are. Then you need to update your site so that you're using those keywords on your site, especially in headlines, in your top navigation, the navigation on top of your website, in your domain, if you can, in your body copy. Make sure you're using those keywords so that Google knows that when people search for those keywords, your site is a good result. One thing to know, though, is don't pad everything too much, because your site still needs to work, because Google really wants it wants to make sure this is a good result for a search. And so Google, if they see people hitting your site going, I can't find anything, this is too confusing, it just says dentist 500 times on a page, they're going to bounce right off again. And Google's going to go, okay, this isn't a good search result. And they're going to downgrade you. So your site needs to work well. It needs to load fast. It needs to look good. And it needs to work as far as for what it's doing, which is marketing your business. And then you need to keep your site alive with relevant content. Once again, this is about keeping people on your site. So Google's saying, oh yeah, people like this site. This can be as easy as a quick 1-paragraph, 2-paragraph blog every other week, or once a month even, just to make sure it's keyword rich, add it to your site. This keeps your site alive. It keeps people coming to your site and visiting it and reading it a little while. So, if you are a dentist, maybe 3 tips for keeping kids quiet at the dentist. Boom, you're good. Move on to the next thing. And then finally, make sure you keep your Google My Business updated, which we're going to talk about in a second. Okay, let's talk about search marketing. And I know I just said that if you should probably pay somebody, but if you are doing it yourself, or even if you aren't and you want to kind of know some best practices, make sure the person's doing it is doing them. Here's some quick best practices. 1, always keep optimizing. With search engine marketing, this is incredibly important. Don't just launch a campaign and let it run forever, or do the Google setup engine and let it run. You need to be going in there and looking at what keywords perform better, what keyword match phrases perform better, what copy performs better. Test, keep optimizing. 2, make sure your keywords are in your ad copy. People forget this a lot, but if somebody is searching for, say, children's ballet flats, which is a long tail keyword, which we would recommend in a campaign like this, you want to have an ad that says we have children's ballet flats in a rainbow of colors or something like that, instead of just saying we have shoes. It makes people understand that you're actually targeting them. And 3rd, make sure you have a landing page that is related to that initial keyword. A lot of people will run their ads and have it just pointing at their homepage, but say again in children's ballet flats, if the ad goes to a page that says children's ballet flats, they can buy them right there, right? Or go to your brick and mortar knowing that you have them, as opposed to dumping them on your homepage, which might have women's boots right now, for instance. So those are sort of our top ones. I have more, like I said at the end. So rushing through here, let's talk about Google My Business, because this is really important right now, especially Google's trying to keep people on Google. And so they want people to use Google My Business more, which means we all need to fill it out and Google will like us better. And when Google likes us better, we turn up higher in the search results, in the organic search results. Remember, those were the gold standard. The other thing is that Lindsey was talking about, is there a place where I can find out what a business is doing ahead of time? And the answer is yes, it's Google My Business. You'll see, I'm going to jump ahead right now. There's a little COVID-19 update here that you can post about on Google My Business. And there also is a health and safety section on your Google My Business that you can fill out and say everything you're doing to make your customers comfortable. So let me jump in 5 things to do right now, and we can talk a little bit more about this, but I think I'm probably running out of time. First and foremost, if you haven't already, claim your business. This means claiming it, getting a postcard sent to you, and you're good to go. Fill it out fully, remembering your keywords. So in your own bio, make sure you're using your keywords in your bio. But fill out every last thing. See, we have this whole like section of stuff that you can look at. Put in videos, put in photos. Don't use stock photos, use actual photos of your business. You know, you have a bio, you have services, you have products, and you have these sections for like your hours and your updates about COVIDs and what you're doing for COVID. So make sure you fill it out fully so that it's 100% filled out. Google will like you for that. Third, think of this as another social media page. I know Aljolynn's going to talk about social media in a bit, but think of this as another social media page. Keep it updated. Google likes it when you update it. Add posts. You go into this little post section and you can add offers. If you have a holiday offer, if you have a holiday event or something, any COVID-19 updates that you have, you can keep adding these things. New products, keep adding them so that it stays alive, just like your website. It's like doing your house maintenance. Make sure you have one for every store and branch. That's sort of a no-brainer. And then get reviews. Obviously, we know how powerful reviews are, but they're also important for the algorithms that show about whether or not your business is going to show up higher in search results. It's really about asking for them, which is hard for some of us. There are review generate. If you get emails and texts, so you have that information, there are review generation platforms that work really, really well. They do cost money, but they work well if you have about $100 a month to spend on something like that. But what they do is they ask for you and they make it really super easy for people to, you know, actually do the review, which brings me to my final best practice here. Make it easy. Don't just, as they're going out the door, say, hey, reviews on Google, because that's hard. They have to find you on Google and they have to figure out how to do it. There is actually a place on your homepage of your Google My Business that says get more reviews, and you have a review first. And when you click on this button, you get a little link here that you can then email people, you can text people, you can write it, get a bit.ly shortener and write it on a card to hand people, something that makes it a little easier so that they know exactly where to go and it's not a guesswork. Okay, so that's my time, I think. If we have time for questions, I don't know if we do, or we'll just do them at the end. But as I said, I have some additional resources. These are articles on our own website about some of these topics. And then I have some more SEO best practices because I only just scraped the surface. So that's it. How'd I do? Did I make it in 10 minutes here?
I think I am gobsmacked and thinking about all the different things that you've covered. Thank you so much, Katie.
You're welcome.
And I think one thing that you said that was really important is oftentimes people hire. Look, if you can do SEO by yourself, you should. You should maintain SEO constantly. If you can do SEM, great. You know, there are ways to do that, but it's time consuming and it's difficult to get results. And so I'm going to brag this much about our next speaker. We launched our Facebook page for Shop Spend Kitsap a year ago. And this summer we ticked up over 300 members of likes. 300 members joined the group. And now we're at 620 and Aljolynn joined us in a contracting basis about 6 weeks ago. So hiring professionals to do this stuff is really, really valuable and you get a lot of results. So let's go to our next professional, Aljolynn Sperber. Thanks for joining us, Aljolynn.
Thanks, Joe, and thanks, Katie, and everybody that is here. All right, I'm going to screen share. I'm just going to assume that you can see it, not even going to ask. But we're going to talk about strategic holiday marketing, primarily for social media for your business. You're going to see a lot of Christmas, but this can be good for any kind of holiday season throughout the year. But let's focus on the Q4 holiday season. So I have a poll question, and I'd love to know from the audience, how prepared do you feel for the holiday spending season? And so you can see there's 5 options, and Teresa's going to bring up a poll for everybody to ask. So I will wait. But the thing is, like, if you are super prepared, 2 thumbs up for you. If you are not prepared in the least, that is okay. Here, I'm going to show a couple of tips here that can help you get to where you need to be to feel good about your marketing. So I can't see on my end if the poll is getting shared, Teresa. Okay, there we go.
It's not the one I wanted to show, but it's working.
Oh, that's the test poll. Okay, but people
it's a duplicate, so it's the same questions.
Okay. And then we'll check the results just so I can have a pulse of how prepared people are feeling. And then Teresa, just keep me posted.
Okay, so you let me know when you'd like me to end.
Oh, now is fine.
Okay. And here are the results.
Okay, so there's a good chunk of you that don't have a plan, but you can adapt. Okay, awesome. Then this is for you. So let's go through a couple of tips, and they're really practical tips here. Nothing, hard to do. But what I like to do is when I'm thinking of holidays, I ideally like to plan out 3 to 6 months in advance. But if you're thinking of the Q4 holiday season, it's really good to use the J months, January, June, July, to plan for the BR months. So that's September, October, November, December. Then that way you feel really prepared about like all the different activities that need to happen to get you to the end of the holiday shopping season. So a 90-day plan can look like however you want to put it together. It can be on a piece of paper, it can be on a board like this, it can be in a spreadsheet. But whatever that is, using a calendar view and putting high-level holidays, weekly themes in a 90-day plan is going to really help you feel like you're on top of things. And it doesn't have to be as busy looking as this one here. For social media marketing, let's use the 3 C's when it comes to that. So content, following the 70-20-10 rule, 70% of the content should be third-party or user-generated. So using content that you get from the community, even reviews is good. 20% of it needs to be your own branded content. So meet the team, any like products that you want to show, even an inspirational quote or a fun image like this, like Santa Claus instead of cookies, so on. And then 10% needs to be promotional. So that's your discounts, any deals, or even giveaway promotions. So if you're posting 7 days out of the week, 7 is third party or user generated, 20% is your owned branded content, and then 10% or 1 post, sorry, is a promotional piece of content. Then when we think of social media, the word social is in there. So make sure you're not just broadcasting. Engage with your community too. Ask them questions. Because sometimes you'll get those frequently asked questions that can help direct what your content plan will look like. And then customer care. It's really important to be responsive to answering those questions for your community so that they feel taken care of, because you're managing your online reputation. Some example content for the holidays. So if you have a physical product that you're shipping, it's really good to let your customers know when they need to order products by, so that that way gifts can get shipped on time. Shopping safe, like Lindsey and Katie have mentioned, customers want to know what to expect when they're visiting your business. So sharing a social media post can really help them, help you help them set expectations. Store hours. We know that during the holiday season, they can change. So letting them know what your store hours, are they longer? Are they shorter? Are you open certain days of the week? Letting them know is going to be really helpful and helping them plan and staying local. And then a promotional one. So I used Canva to put all of these examples together, and there's so many great templates that you can find on there. And so you can even like type in COVID to find some examples for COVID posts, and then shipping and store hours. There's all these different resources that they have available to you that are for free on Canva. Okay. So some social media marketing hacks. These are really great to make sure that you're getting engagement and that your posts are getting seen, and that you can even grow your following. So on Facebook and Instagram, right before you know that a post is going to publish, it's really good to engage with your audience right before. So if you have certain followers that really engage with you, or if you know of any influencers that would be relevant to your business, then it's really a good time to like their post, comment on their post, and even share it on your own social media. So then that way your posts will get bumped up to the top of their feed, and then they'll engage with it too. So that's one little hack. A Pinterest tip is making sure you're using keywords when you're uploading photos to your Pinterest account. And you want to showcase anything related to your business, product photos, tips or anything, and making sure you're using keywords like holiday gift idea for your pet, holiday gift idea for your daughter, or even gifts for him. Those are some keywords that you want to use for the holiday season. And then taking advantage of all the different features on Facebook, Instagram, and Twitter, and whatever you're using. Don't just do static photos. Use the lives, use polls, use reels, which are like the up to 1 minute videos. Use all of them, because when you have a mix of content, then then the social media algorithms bump you up. It's called kind of like story bumping. And then Instagram, when it comes to your physical location, don't just tag your store location, please. Tag the town too. You want to mix it up. So maybe, one day you post the actual physical location of your establishment, and then the next day you post just the town or the county. That way, when people are visiting, your store isn't just showing up to people who know about it, but also who are in town and just like looking up Silverdale, Washington. So those are some hacks and tips for you. Some of the marketing tools that I love to use outside of the social networks or native networks are OnlyPult. It's an amazing social media management platform. It's the only one that will actually let you schedule Instagram Reels and Instagram stories without push notifications. So making it really like just one step for you instead of having like multiple steps to post an Instagram story. Community, it's a texting back and forth tool that you can use. It's not just SMS marketing, but actually a great way to interact with your audience. Flowdesk is a very affordable email marketing platform. Its user interface is very easy to use, and it has beautiful templates. So if you're not design savvy, then you can work off of their templates. And then I mentioned Canva. It's a beautiful visual content creation tool. They have free versions and then very affordable paid versions too. Okay, so up next, I'm gonna step out of the presentation that I'm sharing, because I want to show you how easy it is to set up a Shopify store. And why do you want a Shopify store? Think about like maybe you have to close your physical location one day. It's another opportunity for you to still generate revenue if you have to close the store one day. And then it also allows you to be more searchable for maybe out of town folks to come and purchase from you. So it's just another sales channel. And then you'll get the presentations after this. So these are clickable. There's amazing free apps on Shopify. And then if you don't want to do it yourself, Shopify provides partners to help you do that. So I'm going to do this really quick and go to Shopify. And all you really need to do is have an email for your business. And you get to do a 14-day free trial when you go to shopify.com, have a password, and then like example store Kitsap. So you do that, and then it takes a couple minutes to populate, but you have your store set up. And then what's going to show hopefully in a couple seconds is, like it'll take you through different questions and you just answer them really quick. You can even skip this step. And what you want to do is just, once you have this set up, is verify your email and then set up one product, at least one product today. If you're able to do that in less than 5 minutes, it's super simple. They have videos to walk you through everything. You go to the products here, you add a product, you find a photo that you want to upload down here, you write a simple description right here, and then the title, what is the product, and then once you're ready and you have, you also want a price, like $9, and then once you're ready, you can just tap save, and then the product is live. So it's really easy. You can do this in less than 5 minutes to set up a Shopify store. And there's some great free resources on YouTube that helps walk you through how to set up your Shopify store in 10 minutes or less. And then there's a really detailed one on YouTube that walks you through it for a whole hour, step by step, piece by piece. So then that way you're ready to go live within an hour. So you can set up a Shopify store in 5 minutes or less, and then have it all ready to go live within an hour. So it's really simple. I really encourage businesses to set them up because we don't know what may come up. And so it's nice to have another sales channel available to you. For Shop, Eat, Spend Kitsap, we have partner resources available on the website. If you would like access to it, please email me or Teresa. I will provide that email address. And if you want a consultation, I am available for that. You can just email me to set it up. So I hope those tips were really helpful. They're very practical tips, and I hope everybody has a successful holiday spending season.
Thanks, Aljolynn, and thanks for getting it ahead of it so much, and getting these tips put together for October as we head into the holiday season. There's still time to optimize and to rely on some of these digital tools. So thanks to you, thanks to Katie. We will take questions for any panelist in the Q&A section. So if you've got questions, please let us know. That said, I'd like to turn things over to Jamie Forsyth with the Small Business Development Center, because I heard some new things have been opened or reopened. Jamie, do you have any perspective on that?
Well,
Hopefully.
are we talking idle, Joe?
I don't know. You're the expert, so I'm done.
I'm not sure. I think some things feel like they've been reopened, and they've actually been opened in some form or another this whole time. And one of the things I want to tell everyone, first of all, it's like, I'm open for business, whatever you got going on. And I'm working with a lot of people now that are like into doing milestones, like buying the place they've been leasing for the last 5 years. And that's really exciting kind of things going on. But wherever you are, I'm here to help you. Idle, though, I want to mention, because now we're at a point where people are maybe reconsidering and thinking maybe I should have gone that idle, maybe I should have taken more, and that's all still available until the money runs out or the end of the year, whichever comes first. And one of the things that's been a big thing for people is that there were very restrictive rules on how you could use it. The idle, I should say, economic impact disaster loan. That's the loan you do have to pay back, but it's over 30 years, very low payments. And that is still open. And one of the things that you get to do now with the expanded uses is that you can refinance debt at a lower interest rate. And there's rules on that. I'm not going to go into all of those, but that's a big one for a lot of people. And so there's a, so that's still going on. You can still apply for that. I'm happy to talk that over with you in more detail. The other thing is that a lot of people are getting tripped up right now because they're in their reconsideration process, which sometimes it's not even your fault, because the first time you submitted something, one person looked at it, and then when they asked for something else, another person looked at it and asked the same questions that have already been asked. And sometimes it's not your fault, but you can't do anything about it. Sometimes, like, you moved a location. Oh my God, there was no place on the application to say that, yes, a year ago that was my address and now it's not. Anyway, it's about perseverance and not giving up. And I've got some perspective on it, having helped so many people through it. And I'm glad to work with anyone that's doing that. The Targeted Idle Grant still available for that low income area of Fjord Drive or Front Street in Poulsbo, as well as parts of Bremerton and Port Orchard. And if you haven't gotten that, don't know what I'm talking about it again, I would just say, just get in touch. And I think somewhere I'll put it in I'm easy to find, Kitsap SBDC.
Yeah, if you could drop your email in the chat, we'd appreciate it, Jamie, because if you're in one of those areas, it's you have the opportunity potentially for the idle. All right, so we're going to stay talking about our communities and talking about local spend next month. We're going to continue the Shop, Eat, Spend message. Dollars here in Kitsap. There's a multiplier effect. It's really important that we do that. We thank all our panelists for joining us today. Do reach out to Jamie Forsyth if you are in Port Orchard, Bremerton, I think it's Front Street in Poulsbo, or if you've got questions about the Economic Injury Disaster Loan Grant. And that's it. We're going to call it. We'll see you next month. where we're going to dial into local spending again. Thanks to our experts, Gib and Lindsey. Thanks for what you do to keep our community safe. Thanks so much to Katie and Aljolynn for their expertise. All right, folks, we'll see you next month. Bye-bye.